Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing cosmetic or aesthetic plastic surgery in the Scottsdale Paradise Valley area since 1992, and all I perform is cosmetic or aesthetic plastic surgery. One of the most gratifying things that I perform are facelifts and facial rejuvenative surgery. And a lot of questions that I get from patients are, Dr. Shapiro, I'm interested in a facelift. What are the different kinds of facelifts that are performed? What are the different techniques? I think that that's a really important question, and I think for people to understand what is done is kind of understand what goes on with facial aging. Facial aging is not just the droopiness of the skin, but really it's the loss and descent of facial volume. So when you're looking at a jowl, it's not so much that the skin has become relaxed, it's really the ligaments that hold the facial fat in place have become lax, and the facial fat has dropped. There's also muscle laxity. So it's important to understand that really a nice, soft, long-lasting facelift that kind of keeps people guessing exactly what's been performed is not based upon pulling the skin. And although still a lot of plastic surgeons do that because it's quite easy and you see a very rapid result, it's really not what you want to do. So there are certain patients that are younger that can have just a little bit of skin pulled, and that's like a mild cheek lift. But usually that's restricted to a much younger patient, generally in the 30s, all the way to the late 30s, maybe early 40s. Those patients really don't have a lot of fat that's descended, so that's a cheek lift. When you get into a facelift, what we're really doing is we're performing some elevation of the deep tissues, the layer that is called the SMAS, that's S-M-A-S, and that's the layer that has the facial muscles and the facial fat in it. And what we're really doing is using that layer to elevate the facial tissues back into this more youthful position and give you that facial volume and shape of your face you had when you were younger. So we're going from that jolly look back up to that more triangular, oval-shaped face that you had when you were younger. So elevating that SMAS takes the tension off of the skin, and therefore you don't see the telltale signs of a facelift. Your scars look great, there's no distortion of the ears, and then you talk about what different kind of SMAS facelifts are there. Well, there's a standard SMAS facelift that addresses both the cheeks and the neck, and that would have incisions along the sideburn, inside the ear, and along the back. You can wear your hair short. There's also a little incision beneath the chin where I make the banding of the neck muscles go away, the turkey gobbler. I also will contour the muscles to give you a more youthful jawline here. There's also a short scar facelift that involves elevation of the facial tissues in the cheek area to get rid of the jowl, but doesn't do a lot to address the neck. And there are some great candidates for that, and that short scar facelift is incorporated in a procedure that I have developed myself and trademarked called a Gen X lift. So that uses the short scar facelift. Now, something to understand is that a facelift generally does not include performing surgery on the eyes or the forehead. That is a brow lift and upper and lower eyelid surgery. A full facelift, people usually use that to designate when a brow lift is performed with the eyes and the face. So that is what people think of as when they think about a full facelift. Now, no matter what kind of facelift I perform, a cheek lift, a short scar facelift, or a full facelift, I almost always will combine fat transfer. And when I do that, I take fat from one part of the body, I spin it in a centrifuge and inject it with a very, very small cannula into areas where I think that you need volume. Generally, it would be beneath the eyes, sometimes the upper eyes, the nasolabial folds, and along the jawline and chin. Oftentimes, both in men and women, I will put a little bit of fat around the corners of the mouth and into the lips to kind of give you that overall beautiful look that does not look done, but looks really nicely coordinated and more matches a much more youthful looking face. So the best way to figure out, I think it's great to read about these different techniques on the internet, but the best way to figure out if you're a candidate and what candidate or what procedure is the best for you as a candidate is to come in for a consultation, learn about what I do. It's great to come in with some questions, but we'll look in the mirror and figure out what the best way to approach this is for you as a patient. Thank you very much.